So good afternoon, everybody. I'll jump right in. We have a busy update here today. Nothing more pressing than the activity in Northern California over the course of the last 24 to 36 hours, particularly two new active wildfires that we're monitoring and putting a tremendous amount of resource and investment in. And that's the Glass Fire in Napa County and the Zogg Fire in Shasta County. The Glass Fire grew substantially overnight, roughly 800 acres to 11,000 acres. A substantial number of structures have been damaged, wineries and other structures in and around the area. Familiar evacuation orders and challenge right now that's been made more acute because of overnight winds. Those winds will maintain themselves. They'll begin to dissipate later in the afternoon, stabilize overnight, which should help with our efforts to take advantage of those conditions and move to advance our containment efforts. But nonetheless, an active wildfire generating a lot of attention, appropriately so, a lot of consternation in and around that region that has been hit over and over and over again over the course of the last number of years. The Zogg Fire up in Shasta County, also familiar territory, literally, not just figuratively. 7,000 acres so far have burned. Consider back to 2017 in the Carr Fire. This is in and around those areas. It's likely the Zogg Fire may make its way into the August complex. I'll update you in a moment on the August complex. Remains the largest wildfire in terms of total acreage burned in California's history. But the Glass and Zogg fires remain top of mind for us as we battle complexes all around the state of California. I'll remind you, a slide that's become very familiar in these presentations, 2019, less than 5,500 fires year to date, 157,000 acres burned. So far this year, 3.75 million acres burned, over 8,136 fires again so far this year, 2020. Still remain vigilant with over 18,000 firefighters actively working these complexes, 27 complexes in total that are currently being suppressed, actively engaged in our suppression efforts. Some 7,100 structures destroyed, and those are the structures that we've been able to identify, recognizing that number. Thus, the plus sign you see there likely is to increase significantly. 26 fatalities, tragically, so far in this historic wildfire season. This season has included these active wildfires I referenced, August being the largest in California's recorded history. Last update was 34% contained. Some 846,000 acres had been burned. Total amount of acreage burned has grown, but not substantially, modestly, to 878,000 acres, now 45% contained. So they are making progress on the August fire, with these winds beginning to subside, to die down a little bit over the course of the afternoon into the early evening. That will help advance some of our efforts in this complex. The northern complex, the Plumas-Lassen area of the state, some 64% contained this time last week, now 78% contained. You see the total number of acres burned has increased modestly, progress being made in that northern complex. The Creek Fire, that large fire, substantially impacted by 100+ million dead trees in the area. It's a federal fire, though it's bled into an incident command that's joined with CAL FIRE and the U.S. Forest Service, meaning a joint command. 278,000 acres were burned, 27% contained. Last week, we've made a little progress, 39% containment, and you can see the total acreage burned beginning to subside, meaning we're seeing a plateauing of the growth of that fire. Again, still a stubborn fire, substantially impacted because of that 5-year historic drought, the number of trees that are burned, and some of the territory that it's being impacted is very difficult terrain for our firefighters to work, but progress nonetheless in that area, again, around Fresno and Madera. And finally, just for the purpose of update, I won't go through all 27 complexes, but I wanted to update some real progress on containment in LA County and the Bobcat Fire. Just last week, 15% contained, 100,000+ plus acres. Today, 62% contained. CAL FIRE has done a wonderful job on that fire with their mutual aid system. Again, that was a stubborn fire for a week plus, but that containment now has gone up over the weekend, over the course of this last week, substantial progress in that effort. And so that's the update on our wildfires. Continue to be top of mind as we're now moving into the peak of the wildfire season. This is a time of year you start to experience the Santa Ana winds down in Southern California, which we'll see some activity later this afternoon, overnight into the early part of tomorrow. So we're monitoring that and a lot of prepositioned assets, a lot of vigilance related to those Santa Ana winds. Very familiar to the people in Southern California, but you combine the heat, you combine the dryness, you combine all the other activity that has led to this historic wildfire season. Clearly, we are maintaining our vigilance, and that remains a top area of focus in this state. Northern California, as I said, the winds beginning to die down as the rest of the day. We move through the rest of the day. Very hot temperatures, very dry conditions, and that means we have a chance at least to get some more aircraft in, DC-10s, the 747s, which become very familiar to the people here in the state of California. 117 aircrafts now working these fires all throughout the state of California. Mutual aid system where we've now requested more additional resources above and beyond the resources we have from 6 different states. But we are, again, fully operationalized in terms of the well-resourced and very abundant mutual aid system that many of you become very, very familiar with. I want to just thank administration, FEMA, for securing 2 FMAGs in those, the Zag fire and the new fire in Napa County, the glass fire. We're pleased to have received those overnight. We have additional emergency declarations in to the White House more broadly as it relates to addressing the needs of individuals and businesses and counties and communities torn apart because of some of these other active wildfires in the state. As it relates to putting out fires, of figurative terms, we're trying to do what we can to maintain the progress as it relates to the spread and transmission of COVID-19. Here in the state, you see the latest numbers, 2,955 individuals as of September 27th testing positive for COVID-19. That is lower than the 7-day average of 3,367. We're seeing real progress in total number of tests beginning to go back up as we've been able to navigate some of the challenges associated with the heat wave and some of these other fire complexes impacting our daily average of total number of tests conducted. But you see that number coming back up north of 116,000 over the weekend, was north of 150,000 both on Saturday and Sunday. The good news is the positivity rate continues to trend downward. 2.8% positivity rate over a 14-day period. You could take a look at where we were 14 days ago at 3.6% positivity, now down to 2.8%. The 7-day is slightly higher than the 14-day, and I'm going to get to that in a moment at 2.9%. But nonetheless, we're seeing a continuation of the decline that occurs, of course, not surprisingly, not only in the positivity rate, but you're seeing the hospitalization numbers here in the state, a 20% decrease over the course of the last 14 days. ICU admissions tracking similarly, a 21% decrease. I say all of this with a point of consideration and caution, though that caution has brought to bear, that consideration rather, not caution, has brought to bear some progress with these county tier reports. Tomorrow, you'll get an update from Dr. Galley every Tuesday on our tier status. I could preview that we anticipate a number of counties moving and progressing into new tiers, which is a very encouraging sign. You've seen just in the last few weeks, we had 38 counties in purple, 9 counties in red. You could see today 25 counties in purple, less, good news, more in red, more in orange. We anticipate some more counties tomorrow moving into yellow tiered status. So again, as we move away from red into orange and yellow, more and more opportunity to modify our conditions as it relates to business activity. But as I said, there's some points of consideration and caution in these numbers, and I want to just focus on that briefly here for a moment. While it's true we have seen a threefold decrease in the total number of cases since our peak mid-July, we are seeing early signs that those decreases are beginning to slow down. They're beginning to plateau as it relates to total number of new cases. What concerns us more is not just the plateauing of cases, again, seen decrease, but a plateauing. But it's some regions that are beginning to see an upward trend in what we refer to and what is commonly referred to by our health representatives, and that's the R effective. Let's take a look here at 3 different areas of the state where we are seeing some increases, not necessarily in cases, but in terms of the R effective. Here at 0.95%, you'll see in the Bay Area, Alameda, Contra Costa, Santa Clara, among many counties, you can see that trend line where in the last few weeks, the R effective is beginning to march back up. That straight line is the R effective of 1. Anything north of that, we can start seeing an increase in cases. We want to keep that R effective below 1. Currently in the Bay Area, it's now sort of snuck back up to 0.95. You can see here in the lower part of Southern California, and this is around Imperial, Orange, Riverside counties, elsewhere, you can see similar trends. This is at 0.97 are effective in these ensembles of counties, or assemblage of counties that we've put forward. Those include San Diego County as well. So still below 1%, the R effective 1 rather, but nonetheless, some concerning trend lines in the last 7, 8, 9, 10 days as it relates to increase of R effective. Let me underscore that trend of concern. And this is what we refer to lazily as the upper Southern California area. More difficult to quantify when you see sort of the ensemble of counties that we included here. Central Coast, a little bit of Central Valley, and the sort of northern part of LA, what we refer to as upper Southern California. This R effective is represented on this slide at 1.02. 1.02 in Kern, LA, San Luis Obispo, Santa Barbara, and Ventura County when you pull them all together. So again, some concern and some points of optimism all mixed into one, but it is simply a reminder of what many had projected and predicted. And that is, we have just come through difficulty of a first wave, but the anticipation of a second wave of this pandemic into the fall season. I believe this morning there were 26 states that have seen an increase in their total number of cases. This is, again, what science had predicted. If we go back to our original form, if we're not cautious, if we're not vigilant, if we're not wearing our masks, if we're not practicing social distancing, physical distancing, and hand washing and hygiene, these numbers can start to tip back up, and that's going to put pressure on our tiered plan and put pressure on our ability to reopen not just businesses, but to get our schools open, again, a top priority for each and every one of us. So I cannot impress upon people more the importance of remaining vigilant, the importance of continuing to do the things that all of you have done over the course of the last month and a half, where we have once again tamed the growth of the transmission rate in the state of California. Never over a 14-day period did we present north of 8% positivity rate, substantially better than the vast majority of states in the southern part of the United States, be it Texas and Arizona, obviously places that have highlighted case rate growth like Florida. But we did experience that increase. We were able to bring those numbers down below 3%, but this R effective rate is a point of caution and consideration as it relates to the work that each and every one of us must do to continue to see a decrease, not just a plateauing of transmission rates. Speaking of seeing a decrease, not just a plateauing of rate of growth, we have to address this issue of homelessness. And I continue to maintain a vigilance, a focus, a commitment, and resolve to do more and do better in this space. And forgive the transition from wildfires and the transition, the crisis of COVID, but I would I certainly argue that the homeless crisis in this state deserves similar attention and resolve and approach. And that's why the last few weeks we've been updating you on our $600 million home key investment. Again, shelters, we believe, solve sleep, housing, and supportive services solve homelessness. This is a frame around housing and supportive services. This is a frame towards transitioning people into some sense of optimism and permanence in terms of moving people off the streets, transitioning them, and getting them back into a mindset of self-sufficiency with support. We have now announced, or rather we are announcing today, our third round of awards. We've already now awarded $450 million, over 3,300 new units that will come up in very short order. This is not necessarily new construction. This is about innovation, adaptation, and I'll give you some examples here in a moment where this new round, this third round of $137 million of awards will go. 19 different projects, 15 jurisdictions. Here's just a sampling of some of those jurisdictions and some of the projects and some of the innovation that we're calling for. And when I say innovation, that's time to project completion as much as it is new strategies. But more important than anything else is moving as this crisis demands with resolve and not waiting 2, 3 years, 4, 5, 6 years, as is often the case between a proposal and a project being completed. But you can see here in Lake County some interim housing regarding permanent housing exits to Larry County, Tehama, Mariposa, focused on seniors and individuals with disabilities. You're seeing innovation in every part of the state, and you're seeing support in parts of the state that haven't received support from the state of California in the past to invest and partner with local counties and local jurisdictions of all stripes, be it cities, not just counties, and obviously with nonprofit organizations that are a big part of these strategies. Just in LA, as you can see, 5 projects that we are investing in, 269 units just in LA proper, Long Beach, 100 units, Santa Barbara, an office conversion project into permanent housing with wraparound service. That's an area of focus, an area of innovation, and including partnerships that we're advancing, Poma Indians, a band of Poma Indians in Scotts Valley, a multifamily residential property acquisition. This is the second partnership with our tribal nations. We want to see more of that as well. Stockton, I want to thank Mayor Tubbs. He's been very, very innovative in his approach to addressing homelessness in his city. He has a motel conversion, was waiting for this announcement today, including efforts we're making similarly in other parts of the state, including Humboldt, where in motel conversion, similar motel conversion will be taking place very, very shortly. We have $200 million, and this is very exciting from at least my perspective and vantage point, and I hope from yours as well. We have found unallocated money, C-19 money, meaning COVID-related money, $200 million of additional money that we now want to invest in our home key funding. This, we believe, will clear the wait list, or get close. I don't want to overpromise here, but close to clear the wait list for projects that were submitted, this unprecedented number of projects that were submitted, additional 20 more projects pending approval of the Joint Legislative Committee, and I look forward to getting their approval and very grateful for the partnership. Holly Mitchell, many others that are part of that Joint Legislative Committee. Once they sign off on this additional $200 million, we're going to try to get these dollars out into these communities, try to clear as much of that wait list as we possibly can. That will put us at over $800 million in just a few weeks. $800 million in just a few weeks, targeting real solutions, tangible and short-term solutions that will provide long-term supports for homeless individuals in this state. This is without precedent in California's history, and I recognize it's not good enough, and that's why I look forward to updating you on a consistent basis, and I recognize our responsibility to do more, and that's what this $200 million reflects, some creativity and some strategies to advance just that. It's also important that we advance the cause of participating in the census. There's been all kinds of efforts to vandalize the census process. The census process has been impacted by bad public policy decisions coming out of Washington, D.C. It's been advanced and supported by good decisions coming from the courts and sound judgment based upon the law as well. It's been impacted by a myriad of issues, be it floods in certain parts of the country, fires out here on the West Coast, and clearly been impacted by what's happened with COVID-19. And that's why it's critical, absolutely essential, that all of us participate in the census. And I say now because we don't have much time left to complete our census forms. Now, the current court decision that went into effect pushed back against efforts by the current administration in Washington, D.C. To end the census immediately, which has no other purpose than to undercounting the number of American citizens, deepening a divide of distrust, and reducing people's voice in Congress, representation, and support. There is no good reason except pure partisan political reasons to disrupt this census process. So we're pushing against all the whitewater, all the headwinds that are coming out of Washington, D.C. And that's why I wanted to update you on these efforts and really try to push this count forward in a way that's deserving of a great state like ours. And why is it important? Because $10,000 we could lose per person that goes uncounted. $10,000. Just think about your own participation. You want to make a contribution to your state, I argue this nation, $10,000 contribution, filling out a form, answering 9 simple, easy questions that are safe and confidential, meaning you don't have to worry about that information being sent to the wrong folks. Simple ways of completing the census, and I'm going to go over those in a moment, but I'd rather share with you what those 3 easy ways are by showing you a PSA that we're promoting, not just today, but it's been up for now a few days.
3 quick and confidential ways you can better our communities simply by completing the 2020 census. Take the census online. Visit my2020census.gov. Next, select Star Questionnaire and answer questions about your household. No census ID required. Give us a call. You can complete the 2020 census by phone in 13 languages. Mail in. If you've received a questionnaire in the mail, you can fill it out and mail your form to the U.S. Census Bureau using the envelope that came with the questionnaire. It's that easy.
And it is that easy. Please go to my2020census.gov, my2020census.gov. If you haven't had the privilege, our collective responsibility as individuals, as active, not inert citizens, to participate in filling out that census. If you can't go online, I encourage you to pick up the phone or take your smartphone, 844-330-2020, 844-330-2020. And otherwise, if you have it, it's been mailed to you and it's sitting there on your kitchen counter, maybe you can dust it off, fill it out, send it in. We have till October 30th, the end of October, October 31st, I believe it is, though there's efforts, again, to deny that sooner. But we have just a number of weeks left and want to encourage all of you to fill out this census. And speaking of number of weeks left, well, number of weeks before we move into the peak of our flu season. Flu season, you'll tend to see sort of acuity in terms of the transmission of flu in December, January. Flu season's just around the corner. We're even seeing some early signs of flu already. Bottom line, this is about protecting yourself. In order by getting a flu shot, you protect yourself and you mitigate the impact of what some have referred to as the twindemic of a potential second wave of COVID-19 transmissions and the flu happening concurrently, putting stress, putting pressure on our hospital system at the same time, draining resources and impacting the quality care that all of you deserve and expect of our healthcare delivery system. And that's why getting a flu shot is so important. I have done this every single year as long as I can remember. It is a simple thing to do, and getting a flu shot is a safe thing to do. In an effort to demonstrate how simple it is and how safe it is, I thought I would just take advantage of a moment of your time and take the opportunity to get a flu shot here and demonstrate what safely can be done by many of you watching. And I encourage you to do just that. And so I've got my nurse here, my doctor, and I've got the right shirt,
Yes, you
which
did.
apparently is an issue. So let's roll up the sleeve.
Just relax that
All
arm.
right. I wanted to show my biceps, because of but I can't do that.
Okay, and just relax.
Tell me when you're doing it. It's done.
It's done.
About as simple a thing as any of us can do. So I encourage everybody to get a flu shot. I thank you for this demonstration. And I remind everybody that the flu season is just around the corner. And so I cannot impress upon you more the importance, the power and potency of getting a flu shot, mitigating the spread and transmission of not only the flu, but as well impacting our ability to care for you, your loved ones, members of the community, as it relates to the spread of COVID-19. And so that is broadly where we are this year in terms of update, or rather this week in terms of an update. You can see additional information here on this slide of purpose of preventing the transmission of flu and the broader construct of helping all Californians stay healthy. We encourage you to do the same. As always, we end by reminding you of the power and potency of addressing not only the issue of the flu, but addressing transmission of COVID-19 of wearing a mask. It's an interesting point that in the southern hemisphere of this country, rather in the world, southern hemisphere, in places like Chile, in places like Australia, in South Africa, they saw a relatively mild flu season because of people's ability to address not only the transmission of COVID-19, but as a consequence, the benefits of doing so by wearing a mask, transmission of the flu. So practicing physical distancing, washing your hands, minimizing mixing, and wearing these masks will also help us with flu season, not just with transmission of COVID-19. So this slide, very familiar to all of you, is even more important in that frame and in light of our pending flu season. So with that, happy to, of course, answer any questions. And again, thank everybody for your time and your attention.
Jeremy White, Politico.
Hey, Governor. Thanks for giving us some time. You have been among many Democrats who have warned about what the impact of a sixth conservative justice on the Supreme Court would be. I was hoping you could talk with a little more specificity about some California policies, particularly parts of your agenda that you fear could be endangered by a sixth conservative justice.
Yeah, I don't want to get too much in the weeds, except to say on social justice, economic justice, environmental justice, broad strokes, I'm very concerned. I'm concerned clearly about tens of millions of people that have pre-existing condition protections because of the ACA, the expansion of the Medicaid system in this country and the impact that could have, millions of people losing the ability to get quality health care as a consequence of the ACA. I'm worried about the environment, the clean air, I'm worried about clean water. I'm worried about the capacity for states like California to continue to lead not just this nation, but lead the world in terms of low carbon green growth. I'm worried broadly about protection of minority communities, the LGBTQ community. I'm worried about a series of issues that obviously present themselves self-evidently as points of concern and points of departure as it relates to precedent, not least of which the impact on Roe v. Wade, the impact on people's freedom of choice, a value we hold dear here in the state of California. And so clearly those are points of concern. 6-3, ideologically conservative majority could be impactful on all of those issues and more for decades potentially to come. So this is a profound moment in our nation's history. And I know that all of us are anxious, at least those of us that share concerns about the stacking of the court from an ideological bent, and obviously makes this election even more essential and more important.
Adam Beam, Associated Press.
Thank you, Governor. I have two questions. First, while the coronavirus numbers have been improving, Dr. Galley warned last week of an expected increase in cases and a potential 89% jump in hospitalizations in the next month. Now, in some counties, that could mean businesses, again, have to close or restrict services. So what do you say to those business owners who say they can't survive a third shutdown? And secondly, as more schools are now offering classroom instruction, have you and the First Partner decided whether your children will attend school in person?
Well, it depends when the school makes a decision about whether or not they can move in that direction based on concurrence with the county. There are hundreds of schools, I think north of 600 the last I checked, though I'll happily update you on that number, that have received waivers from all over the state of California in elementary schools. My kids, oldest just turned 11, youngest is 4, so we're in that category broadly. But beyond that, I have no update for you as it relates to my specific status and my family. As it relates to the broader issue of transmission, I would say to all the business men and women, I would tell all the entrepreneurs and parents included that we maintain our vigilance. If we continue to practice physical distancing and social distancing, we minimize mixing. If we abide by these mask mandates, then we can substantially address the concerns that you raised in your inquiry, and that's fundamental and foundational. We all need to maintain our vigilance. As we modify, as we make progress, and we are making progress, you will hear Dr. Galley tomorrow update you on the tiered status. Many new counties are moving into new tiers that will allow them to modify with modification to begin to reopen businesses and the like, that we do so safely and we do so with our eyes wide open, that we again are moving into the fall. And so if people can take seriously and not let their guard down, take seriously this moment as we transition through the fall and hopefully into spring, where we have a vaccine and we can turn the page on COVID-19. If we can do everything in our power to mitigate that spread in the course of the next number of weeks and number of months, then we can avoid the example that you just set forth.
Angela Hart, Kaiser Health News.
Thank you, Governor. I'm sorry if there's a little bit of background noise. I just wanted to ask you sort of a bigger picture question on healthcare-related legislation. I understand, even if it's more of a broad question, not necessarily asking about a specific bill, with lots of people losing their healthcare right now, I wonder if there's anything that you're going to do this year from a broad perspective to address some of those challenges legislatively. Is there anything that will help people with coverage or even cost-cutting measures? And then kind of looking forward, I also was wondering, similar question, pitching into next year, is there anything realistically on the healthcare cost or expansion effort that will be realistically possible that's on your agenda next year?
Yeah, we're committed to universal health care in the state of California. We made progress to advance the cause of not only physical health this year, but also brain health. New parity bill, package of mental health, substance abuse reforms that I signed just last week as an example of those efforts. We are committed to the long haul of not only reforming our Medicaid system, Medi-Cal here in the state of California, through a program called CalAIM into the future. It was delayed because of budgetary constraints this year, but that reform we are committed to advancing over the course of the next few years to reimagine our mental health and physical health financing system, funding system, incentive system, prevention system, a program that we have worked hard to design, and now a program that we look forward to advancing. So we are committed to that cause. I'm already